Hey everyone, I'm Anastasia, America's Dental Hygienist, and your host for Straight Talk. And today we've got Jen Post back joining us. She is adjunct professor at University of Minnesota and a practicing dental clinician. So Jen, welcome back.
Thank you. Good to be here.
Let's just take it a little step further this time and talk about ideal levels of fluoride that either are in office or take home for our patients.
Well, everybody knows about over-the-counter toothpaste. Those have 1,000 parts per million. Those are good products. But if you have increased risk, we want you using higher fluoridated products. So that would be the 5,000 parts per million formulations that you can get from your dentist. I think a lot of patients don't realize that these prescription level products exist, and so it's really important for dental providers to share that information and let patients know how important these levels of fluoride are for them.
Totally agree with you. Now to go on with in office, we were talking earlier because varnish, now I remember when we were kids, and you probably do too, but the fluoride was for 4 minutes and it was a gel, and Jen, it was the worst ever.
So glad that the foam trays are gone, because you're right, that was, people were gagging, choking on those fluoride trays, and we have such a better vehicle to deliver fluoride now in Fluoride Varnish. So the Fluoride Varnish, it's painted on the teeth, and then it sets up in the saliva, and it's available in the mouth for 4 to 12 hours, doing what fluoride does best in bringing minerals into the tooth. So we have people leave it on for a minimum of 4 hours before they brush their teeth again. But most of the time, we're encouraging people to wait to brush until like the next day.
Fluoride treatments for many patients, even still, I have some that say, do I really need a fluoride treatment? I haven't had it in years. Have you experienced that?
I've experienced that a lot. People say, oh, it's in the water. Oh, I have that in my toothpaste. But it's not, especially if you're at high risk, that's really probably not enough daily fluoride to have. And then adding fluoride varnishes up to 4 times a year, that's a super dose of fluoride that we find is really effective at preventing cavities.
For children, are they able to receive it at the pediatrician's office?
I know when I take my kids to the pediatrician, I see fluoride varnish available in the office, and they ask about that. So basically, other providers can be applying fluoride treatments, and I hope that that increases more and more, because if kids don't make it to the dentist, they might not be getting these high levels of fluoride, but they might make it to the doctor at least once a year.
I thank you so much for your time. It's just so nice to sit down and have a discussion on how we can help our patients from infancy to their, all stages of life. So, hey, thanks for your time again today.
Thanks, Anastasia.